The symptoms of Parkinson's disease and the side effect of the medications used to treat Parkinson's disease can affect your ability to drive. Your age plays a role as well, since Parkinson's disease is more common in elderly people. In a study done in 1999 by the National Center for Injury Prevention and Control, it was found that motor vehicle injuries were the most common cause of injury-related deaths in the age group of 65 to 74. For those aged from 75 to 84, it was the second most common cause of death after falls. Of course, having Parkinson's disease does not necessarily mean that you will not be able to drive anymore. However, individuals with advanced Parkinson's disease are at a greater risk of being involved in a traffic vehicle accident. Therefore, it is important to judge yourself whether or not you are fit enough to drive. Unsafe drivers on the roads not only pose a risk to themselves but also to others. As Parkinson's disease progresses, you may experience a decline in motor skills and reaction time. Due to a slower reaction time, it takes a person with Parkinson's disease much longer to react to a situation and take the necessary step. Attention, information processing, and visuospatial skills, which help in differentiating between shapes and determining distances, are also declined in Parkinson's disease. So a person may have difficulty judging correctly how far a traffic light is, have trouble in keeping the car in proper lane, difficulty checking blind spot, handling the car smoothly, steering and proceeding forward when required, changing lanes and making turns. Additionally, a person may be more prone to mistake if distracted while driving. The medications used to treat Parkinson's disease may cause side effects such as sudden onset of sleepiness, blurred vision, drowsiness, confusion, and dizziness, hence affecting your driving skills. It is difficult to do a self-assessment and decide whether or not you are fit to drive. Many individuals are overconfident about their driving abilities and may not realize that they are unfit to drive. Driving is also a sign of independence which people cherish. You should talk to your family members and friends and ask them about your driving skills. Listen to their concerns and determine how serious they are. You should avoid congested roads, driving at night time, and during bad weather at all times. If you have a close call while driving, or if you don't feel comfortable driving anymore, you should consider taking a defensive driving course. You should also contact your local driving center and have a driving test to see if you should be on the road or not. Of course, your license would be cancelled if you were to fail the test. Some driving schools may do practice road tests and let you know whether you would pass in a real test or not. For an off-road evaluation, some rehabilitation centers examine your reaction time and perform your memory test to see how these would affect your driving skills. Additionally, if you have advanced Parkinson's disease, you should consider giving up driving. It is better to be extra careful when you move to higher dosage of anti-Parkinson's disease medication or when a new medication is started. A caregiver should observe the driving of the person with Parkinson's disease carefully and point out the driving fault in a manner which is respectful. The caregiver may need to convince them that their driving is not safe. A driving test or input from a professional may help. The caregiver can also provide alternative options to driving that may help the person with Parkinson's decide. These options can range from using local public transit system, using taxis or other services which a city may provide. Although taxis may seem expensive, the cost of owning a car is very high as well. When the cost of the two are compared, they come about to be close. Family and friends may help by giving rides. The caretaker can also outline bus routes and note down phone numbers for taxis. Driving may be an important part of an individual's life, and it can be hard to give up the keys. However, your safety as well as safety of others on the road is very important. If you feel that your driving is not up to the par with safety standards, you should consult your physician. This information is provided for educational purposes and should not be taken as a substitute for the medical care and advice provided by your own physician.